Hello guys, welcome back to my YouTube channel. So today we'll be discussing about something really important on this platform. Today I'm introducing a tutoring class, a friendly tutoring class. Disclaimer here, I'm not a lecturer, I'm not a teacher, and I'm just a student. I'm a nursing student, a nursing student, a person who loves sharing information, a person who loves teaching and telling other people what I've learned, and actually also helping people to understand the little I've known. So let's begin. So today we'll be discussing about a course titled Family what Health. This course is Family Health. As a nursing, we are discussing what Family Health Nursing. So this is Family what Health. Family Health, okay? So Family Health Nursing, that's what we are talking about here. So Family Health was nursing. So not what is Family Health Nursing? If someone asks you, because you cannot talk about a course without introducing what that thing is. So the definition of, or what do you understand by Family Health Nursing? So Family Health Nursing, we know, is a unit of what? Community Health Nursing. So Family Health is a unit of what? Unit of community health nursing. That's just it. All right. So now, what are we looking at? Someone will say, "Oh, what do you mean by is a unit of community health nursing?" All right. So let's pick this word: family health, community, family and community. All right. So now we're going to bring it down: family, community. So what do you understand by family? We all know that family, in a layman understanding, family is a social group that includes the father, mother, So we all know that family includes the father, mother, children, extended family, uncles, auntie, and so on, grandfather, all right. So but when you talk about, and all these people are related by blood, do you understand? So now when we talk about community, what are we talking about? What are we looking at? So community is made up of what? It includes large amount of people. Now this large amount of people, of course, in a small region, of course, we all know that this community includes both blood related and also what? Not blood related, okay? So now it's just like you call it a village. This village, that they're included with what? Strangers. Strangers can come to make up what? This community, this village, all right? So that is what community is all about. So now we now say that family is a unit. So meaning family is coming out from this community. Do you understand? Okay. Family is a unit because you will find this family here. I hope you heard me when I said family, blood related, they're also here. So that is why I'm just saying, okay, just something you can use to remember that particular thing. All right? Okay. So like me, I'll remember that. Of course, in the community, there's family there, there's other people there that which are not related by blood, who are not related by blood, of course. Now, we expected our family here, meaning that's what they say is a unit of what? Community health nursing. So now let's tell the difference. What do you understand? What are the difference between family health nursing and community health nursing? Family health nursing, and what? Community health nursing. What are the difference? What are the things that make them different? This family health nursing, we say it's a unit of this community health nursing, right? Now, if we want to talk about this community health now and this family health, what are their roles? What are their specific duties? What are their specific roles? What are their specific responsibilities that they have. Now, for a family health nursing, okay, now we give birth to what? I'm so sorry to you, we give birth to. I like using that word, I don't know why. But family health nursing, okay, a family health nursing will actually bring about a family health what? Nurse. Now, it's just like in this our nursing profession now. In a nursing profession, a nursing is a body, is an organization that trains who? A nurse. So that is it. So as for a family health nursing, you have a family health what? Nurse. As a community health nursing, you have what? Community health nurse. Is that right? Okay. All right. So now I want to tell their both responsibilities, because their responsibility differs. Okay, because this one family, okay, this one family, its responsibilities is to care for what? The family. Why this one? Its responsibility is to care for the what? Community. Okay, let me, does not mean that this one does not care for family too. Remember that this one now, family is inside, other people is inside, but now this particular one has a specific role to make sure that the family receive, or they are being treated well, that the family, are getting the benefit of health, or of healthy living, you understand? So now this family health nurse, its responsibility is to do what? Is to care, is to manage, is to plan for the family, is responsible for the health of the family. Now, this family can be an individual in the family. Individual what? Member of the family, or of a family. And can also be members of the family.